particular broadcast as we carry on tonight. Well, Dr. Rile, there's another question that is coming through now from WhatsApp. I've seen one here from a friend who is very, very keen listening to the program as we began and still talking about matters to do with the health of our bones. Let me get to it so that we can highlight it tonight. And yes, saying they're writing from Mombasa. I fell like 12 years ago, and my right shoulder developed some pain, though didn't break. I went through some X-ray and physiotherapy time, and again, sometimes the pain comes back, and I can't lift like 10 kg weight. What should I do?
That's an interesting question. So earlier we alluded to some group of muscles within the shoulder joint that allow us to have motion. For those who are interested, the group of muscles is called the rotator cuff. So the rotator cuff can get torn, and what he's describing is weakness. He says that it's been 12 years ago. So the rotator cuff usually helps to keep the integrity of the shoulder joint intact. More than over and above causing motion around the shoulder, it can cause an incompetent rotator cuff can cause the development of arthritis, of the shoulder joint, which is called rotator cuff arthropathy, which is basically arthritis of the shoulder joint. So it depends on the spectrum. If it's been 20 years, I would imagine that probably it has gone ahead. However, I think we need to have that evaluated. So if you are a patient in my room, I would be able to examine you, check for the strength of the various muscles. There are a group of maybe 6-7 muscles within the rotator cuff. Examine all of these muscles, and then be able to know of the rotator cuff what is competent, what is not. Because of the duration of how long it has been, he's mentioned 12 years. If it comes in early, then there are options of having a rotator cuff repair, which is usually a minimally invasive surgery. If it has developed and there are changes within the shoulder, arthritic changes within the shoulder, then what is offered is usually a type of replacement of your shoulder. It depends on what work you do. It depends on what your expectations, what work you hope to go back to doing once this has been done, this surgery has been done. Please seek help. It's something that can be treated.
All right. Thank you for that. Somebody here who is listening to you very keenly and has been a friend for some time saying, greet Dr. Felix. He's a wonderful and humble doctor of the spine. His experience through my son, Prince. He had a spine bend, and so far the boy is doing well. God bless for the work he is doing. And glory be to God. That's from Mom Prince, all the way from Samburu.
Yes. She texted me earlier today.
So she's listening
She's listening. She told me she'll listen in.
Wow, great to hear that. Then another one here, 35-year-old lady, and says, my daughter, after my daughter was born normally, that is no CS, 3 years ago, while exercising, I noticed that my right pelvic joint hurts a bit and makes noise. When I walk, it doesn't hurt. That joint still behaves that way to date, and it feels tight when exercising. What could be the issue?
Again, issues around childbirth and back pain, and also pain within the pelvis. So if you have pain within the pelvis during the process of childbirth, the pelvis has to sort of open up to be able to allow the child to proceed. So questions that I would ask: was the baby bigger than usual? Was what kind of stature are you? Is she a short lady? Small? So the issue is small pelvis, big baby. So if you have a small pelvis with a big baby, then that tends to bring a bit of an issue there during normal delivery. However, there are some patients who, once it opens up, it fails to return back to where it was before. So you have a bit of widening. So there's a joint smack at the middle, at the front of your pelvis, which we call the pubic symphysis. So if that joint does not go back to where it was before, so you can do it an X-ray and find that it's a bit open. Many cases are treated non-operatively, but it's also something that needs to be evaluated. And if it is a cause of consistent pain and problem, then we can see what to do in terms of treatment.
All right. And another one here. Yes, and this one is sharing, saying, sometimes I do have spiking pain on my left rib, sometimes the right one, and at my back. What could be the problem? Number 2, I've been feeling pain on my head, sometimes on the right, left, and back. I don't feel the pain on the whole side, but just a small point. What could be the problem? That is a 27-year-old listener here who is concerned about this pain.
Sounds like she needs to be evaluated. That would, if you walk into to my office, I would be concerned about cervical spine. So your spine around your neck, the spine around your neck having some sort of issue. Causing a nerve compression somewhere, and that usually sometimes can present as a headache, especially if it is very high up. If you have an issue within the thoracic spine, so the nerves that supply the anterior chest wall, so the front part of your chest, usually come out from the back and then traverse and then come to supply that area. So if you have a compression, as we were describing earlier, so if you have a compression at the back, you could feel that at the front. Another question that the more life-threatening issue is it a pneumonia? Because there are other myriad of reasons why you could have chest pain. Do you have gastritis issues with acidity? Is also something that I would also consider. Try to rule out any other reason as to why you could be having chest pain. How long has it been there? Is there any fevers, any cough associated? But if it is just coming from the back, then I would imagine to be able to evaluate the back, the spine, the cervical spine, and the thoracic spine.
All right. And there's also another friend here who is listening in. Your name is Samuel Karomo from Ushada in Kiambu. You say, thanks for tackling this subject today. Been having pain on my knees since the beginning of last month. Went for an X-ray, but nothing was detected. Could wear and tear cause this pain or be the cause of the pain? In July and August, I did a lot of running for my exercises. And right now, I can't run. Yeah, Samuel is really, really concerned.
Yes, so Samuel is one of those guys who have decided to be active and get themselves moving, which is always a good thing. However, I think, so pain generators in the knee could be many things. So you could have anything from arthritis, anything from tears in the ligaments that hold the knee together. There's a cushion within the knee. There are two cushions within the knee, one on the inner side, one on the outer side. Those cushions are called meniscus. There could be a tear, especially if he fell, he did something, or a childhood injury that he cannot remember and tore his meniscus. That can give you pain. However, there is something called the weekend warrior. So the weekend warrior, on the 1st of every year, we see people saying, and me included, that this year I will do things right. So in January, the gyms are packed.
Yes.
And when that happens, you're lifting so much weight, you're running such long distances, and I think maybe it would be a good idea to gradually increase the intensity and the intensity of your exercise, and also the duration. So tell yourself, today I will run for 20 minutes. 20 minutes, be done with that, go home. Do 20 minutes for 2 weeks. Do 20 minutes for 3 weeks. Once you can easily and comfortably do that, do 22 minutes, do 25 minutes, slowly building your capacity. Don't be like me, who wants to put in the most effort now, and then cause problems. The other thing that you need to consider is getting the proper shoes and the proper running surface to be able to make sure that you minimize, because every time you step and your foot hits the ground, there's a lot of force being transmitted along your joints. And if you do not have the right shoes, if you're not running on the right surface, then that could be a potential for issues. Swimming, as we were discussing before, swimming could be a good option also for exercise, because it's usually a low impact exercise that you can be able to do.
All right. Exercises and the effects to it and how best to exercise. That quite explains it well. Thank you so much for that. Coming up to 13 minutes to 9 o'clock, more of your questions here. And this one is concerned, saying, "Hi, Doc, what's the best time to bask for vitamin D for those of us aged 40 years plus?" Yeah. What would you tell them?
So the last research that I looked at was usually maybe between 10 o'clock in the morning, around early mid morning. Would be the best time. Would be the best time to be able to go out. Don't go when the sun is too hot, maybe at noon. So maybe between 9, 10, 11 o'clock, somewhere that would be good. And then also you want to maximize the surface area that the sun is in contact with. So don't go too, of course, within reason, to have as much of your skin exposed to the sun as possible.
All right, that helps. And I see another one here. This one says, well, let me check this one first. This one who says, "My right knee," talking about the right knee, "has some pain below the knee bone, which is on and off, especially when I do some jogging. During the exercise, it becomes severe for like 2 days, paining. What could be the problem? Kindly advise." 42-year-old Sliter. Yeah. Sliter. His name is Sliter.
Oh,
yes.
Okay. Interesting name. Okay.
Yes.
Yeah. So below the knee. So there are several structures below the knee. There is the attachment of the muscles that help you kick your foot. So the kneecap is attached to the leg bone, the tibia. At that point, there could be an issue at that point of attachment. There could be some inflammation there. In people who kneel quite a bit, they usually cause a bit of pressure at that point, and that could be a pain generator. There's a group of muscles, the muscles that allow you to bend your knee backwards, which you call the hamstring. So some of those muscles come to attach on the inner side of the proximal tibia, of the proximal leg bone. So that can also be a pain generator if at all that attachment is inflamed. It could also just be coming from the knee. There could be some issues with the kneecap. There could be some issues with the cartilage. There is a nerve that sits on the outer side of the knee, which you call the common peroneal nerve. So the common peroneal nerve would give you some pain as well. It's a pain generator if at all there is some form of compression on it. Just have someone examine you, listen to your story quite well, examine you, actually go around your knee and ask you if you're to point with one finger, where is the most pain. Then from there you can be able to work backwards and say that this is the pain generator from there.
Oh, all right. And another one here who says, "I have a stiff neck that causes a hangover feeling in my head that gives me anxiety. It gets worse when I travel. I saw a spine specialist, did an MRI of my lumbar and upper spine 4 years ago. My spine was good, but muscle tightness was spotted in my upper spine. This is affecting my quality of life. What should I do?"
Pole for that. I think, as I said, for every patient in whom we do an MRI, an X-ray, we'll always find something. So muscle spasms usually happen because your muscles are trying to protect against movement of your spine that is causing pain. So your body's way of protecting that is keep everything tight, keep things from moving, then there'll be less pain. The effect of that is that it can cause your spine to look straight on X-rays, and hence is being described as the stiffness. What I would suggest is from 4 years ago, I think that's when she did her MRI, if I remember correctly, there could be some changes. So have that evaluated, whether there has been a progression in disease, what was causing the spine to protect itself, the muscles of the spine to protect the spine. Maybe that process has progressed. Have someone see you for that, and then evaluate this anxiety that it's giving you. Maybe dig a bit into that. What would give you anxiety because of that? Maybe there's an issue there that also needs to be resolved. But all these services, I think, are available. I think you just need to reach out to someone who can be able to help.
All right. Thank you for that. And as we conclude, there are a number of people who have been asking this question. Probably we will conclude with it regarding the knees and the knees producing cracking sound when standing or kneeling. I've seen a number, 3 people or so asking that question. So I said, let me just bring them together and asking what could be the problem. Also, I cannot squat because I experience very sharp pain. Terry.
All right. So that sounds like knee osteoarthritis. So when you move an arthritic knee, and even I do that when I'm examining my patients, I even take their hand and tell them, put your hand on the knee and just bend it and straighten it and tell me what you feel. There's always this crackling sensation that you get in your hand that points towards arthritis, especially between the joint between the kneecap and the bone below, which is the distal thigh bone. So with that, and they describe pain, some people describe swelling, and even some people go ahead with wearing out of the joint. Then there could be an abnormal angulation of the knee. So either the foot moves inwards or moves outwards from the center. So with knee osteoarthritis, the management, if you've come into my office, it's the first time I'm seeing you, I'll put you on physiotherapy and drugs. If that does not work, if you have a lot of pain, there is a steroid injection that we can inject into the knee. So it's a local steroid. It keeps you away from the systemic, the body, the rest of the body is not exposed to these steroids. I do that to a couple, maybe to about 3 joints, three injections, sorry. Once a patient exceeds 3 injections, then you start moving towards surgery. So surgery for knee arthritis is a total knee replacement. So it's one of those surgeries, the total knee replacement, total hip replacements has become one of those surgeries that is causing a lot of change in the quality of life of a lot of these patients. So it's giving you pain relief because you no longer have a joint. So it's when I say that, you no longer have the natural joint. So we take out the bony the joint that God gave you, then put in a metal implants into your knee, and then usually we have some plastic in between, and then have you walk on that. Usually that gives you treatment. That is the final treatment of knee osteoarthritis, and that gives you a lot of relief in your symptoms.
All right. Thank you so much, Daktari, for sharing great insights. Somebody was asking here regarding patients. Do you nowadays see adult patients at Cure?
As from January 2022, we stopped seeing adult patients. However, we are in touch with various nearby hospitals who we can be able to refer you and actually get help from them.
Right.
So Cure in itself has moved back to our mission, which is seeing children with disabilities. at least we can focus on that goal, that we can be able to make a difference in those patients, because there are many hospitals that you can get adult care. So moving back to our mission was our biggest drive to come back to do pediatric orthopedics. However, we're in touch with different hospitals where we can, and different surgeons who we can be able to refer you to and actually get care.
Concluding thoughts, even as you give us the contact, how somebody can get in touch with AI Secure.
I think the biggest thing is that we all have, I think bony issues is a big part of our day-to-day living. Making sure that you're taking a high dietary input of calcium-rich foods, yogurts, milk, and also getting yourself exposed to the sun for vitamin D, getting yourself exercise 2 to 3 times a week. Making sure that you do not let your problems, if you feel that there is an issue, have someone see you and actually see how to help early, because a lot of these things can be managed well if they are found early. Yes.
And how can somebody get in touch with AI Secure?
So the cure, we have 2 points of contact. Okay, 2 major points of contact with patients. So one is the cure outpatient department within Kijabe, where you can reach us on 0733 290 903, which is 0733 290 903. So that's the cure OPD outpatient department. So we have a clinic in Nairobi, which is at West Point Building, Mpaka Road, on 4th floor. And this number is 0733 790 421. That is 0733 790 421. Those are usually our major points of contact. However, we go around the country seeing patients. We go to Bura, we go to Kargi, we go to Nyeri, we go to Meru, we go to Matu, where we are able to, we even go to Samburu, where Mama Frings comes from, where we also find a way to come closer to our patients.
All right. Thank you so much. I pray that God will continue to protect you, continue to grant you wisdom as you continue to serve Him in this capacity in your profession as a doctor. And we pray that God will use you mightily.
Amen.
Yeah, and say hi.
Asante sana, asante sana. And to you also for having us and also keeping us every month on our toes.
Yes, that's right. That's right. And say hi to our friends there at AICQ.
Correct.
All right. Thank you.
Asante.
Tonight we were hosting Dr. Felix Kuguru, who is an orthopedic